She's a fighter.
She is. My wife and I are both neonatology attendings here at UCSF. We care for the same population of patients and we're in the same NICU. We were able to use this ventilator and we believe it helped her.
I was a third-year medical student. During third year of med school, you do rotations, and pediatrics was my last rotation. But Tom was the intern I worked with, and we had said at the end of my rotation, oh, we're all gonna get together and play golf. I'm terrible at golf. But we went to play golf, and that was, yeah.
I was a fellow in neonatology, and she was a resident in pediatrics, so we were 3 years apart in our training, but we were together in Chicago and we got married and had our reception in the faculty club. So we were literally tied and wed through our training. We had our first child when I was in my last months of fellowship and she was in her last months of residency. And we moved to San Francisco when he was 3 months old. And it's really been a wonderful ride. We've had 2 more kids since then.
Oh, sweetie.
If you were to ask the nurses, they would tell you that Tom and I are the parents of the nursery, that it is a big family. When you work in an environment where you're dealing with critically ill babies and they're very stressed parents, it creates an environment where you have to depend on each other 100% to be able to go from one urgency to the next.
The initial x-ray looked clear. We're often caring for the same babies at different times. So sometimes if I have a question or I'm thinking about a challenging case, it's something that I can talk to her about and vice versa. People who know us both know that she is the yin to my yang. We really are very different personalities in some ways, but we complement each other, I think.
His strength is that he does everything from a place of kindness and not of needing to be right. His ego doesn't play into it.
Hey, it's Janet.
She is super organized, very detail-oriented, and I'm a little bit more of the gray zone person, and I rely on her to help fill in some of those gaps for me, I have to say.
Our kids are used to it. Their whole lives, there's one night a week that mom's on call and one night a week that dad's on call, and they're just used to it.
They understand the sacrifices that we have to make, being on service, coming home late, leaving the home early before they leave for school. But they've never complained, and I think they appreciate and maybe are a little proud of what it is that we do. And I really appreciate that about my kids.
The fact is that we every day are allowed into this very sacred space of caring for other people's children. And I think that we consider ourselves incredibly lucky to be able to do that here, where we love our team so much. And to continue to do this, this is our 3rd decade of working together. And I can't imagine a different life for us.